All right, so hello everyone. My name is Miss Sam. I am one of the teen librarians here at the Levittown Public Library. For the month of July and August, we're going to be celebrating all of our first responders. And today we are honored to have Brandon Leonard with us, who is a police medic with the Nassau County Police Department Ambulance Bureau. He has been in EMS for over 20 years and is currently operates ambulance 2378 in the 8th precinct. So I just want to say thank you so much for being here and taking time out of your very busy day and joining us. So I'm going to throw it over to you, Brandon, if you could just tell us a little bit about yourself and how you got to where you are today.
Thank you for the invitation and for having myself and other colleagues here. In short, I've been involved in EMS since 1999. I just kind of took a liking to medicine, and my aunt got me an emergency vehicle years and years and years ago, lights and sirens, and it was just one of those things that I became attracted to. I had an interest in medicine, and then kind of leaping into EMS was a nice combination that satisfied those interests almost 20 plus years ago.
Nice. Can you tell me a little bit about, we had talked to a volunteer EMT, and we were discussing kind of the differences between a volunteer EMT. Obviously, you're a police medic, so it's more on the career paid aspect of that things. Could you talk a little bit about what the benefits and drawbacks of each, or what the differences are between those two?
Sure. So in EMS as a whole, there are two divisions of life support. There's basic life support and there's advanced life support. The basic life support consists of your emergency first responders, formerly certified first responders, and your EMT basics. And then your advanced life support. At this time, one of the new certifications that New York State has recognized is the Advanced Emergency Medical Technician. You have your EMT CCs, which are your critical care technicians, then your EMTPs, which are your paramedics. The AEMT, the EMT-CC, the paramedic offer advanced life support. As far as the difference, we all have the same training, whether we do this on the volunteer side of things or we do things on the paid side of things. Sometimes the volunteer side doesn't see the volume that the career paid medics do, or the career paid EMTs do. It's on a volunteer basis, as you said. So it's being able to have that availability in your own schedule to be able to have that exposure. As a career paid EMT or career paid paramedic, your exposure is on a daily basis.
Could you also talk to us a little bit? Obviously, there's training that goes into it, and what kind of training did you have to go to? Did you have to go to get a specific? Was there a degree? Is there a specific license, or how? What is the educational side of your career?
In New York State, you obtain a certification. Your certification is good for 3 years. So obviously, your level of training will dictate how long your educational requirement and course is. The EMT program is approximately 6 to 8 months. The critical care program is around 12 months, but that no longer is being offered by New York State. I'm not so familiar with the AEMT program. The paramedic program is anywhere from 12 to 14 months. And then in order to work for the police department, you need to maintain either a critical care or a paramedic certification in order to apply for the position as police medic.
Gotcha. And are there any restrictions, either by age or education, as far as to be able to enroll in those programs?
A requirement to obtain those certifications, you need to have a high school degree, and like I said, either have a certification in critical care or a paramedic in order to apply. As far as other restrictions, age, not that I'm aware of.
Okay, great. And then kind of let's go through a little bit about your typical day. So obviously in medicine, we know, and especially emergency response, that can vary greatly from day to day. So could you talk a little bit about, is there anything that is consistent throughout your day that somebody would need to be aware of or prepared for every day, or does it change drastically every day?
The only thing typical about my day is that I get dressed and I push the button and I sign on to the computer. No 2 days are the same. Each day is completely different from the last. The spontaneity, I think, is what keeps most people intrigued and gives the little adrenaline rush. But no, there is nothing typical really about the day.
Gotcha. And then what would you say, are there any limitations to your personal or social life due to the nature of your work? Are the hours consistent? Do they change drastically day to day or week to week, or how does that work?
As far as limitations are concerned, no particular limitations beyond that of any civilian anywhere. But I feel that being an employee of the police department is a certain standard that you must uphold. Your family, your friends, your neighbors, everybody's always going to count on you in that time of crisis or need. Um, Being prepared and being able to act in that time is kind of an old school mentality that I maintain. It is a 24-hour operation, and I particularly am assigned to days, so I work from 7 a to 7 p at night. Whether or not you get out on time is who knows. That's in the universe. That's in the universe's hands. As far as rotation is concerned, we rotate throughout the year, so we work our set schedule, and each month our schedule changes a little bit. But if you're assigned to days, you're assigned to days. If you're assigned to nights, you're assigned to nights.
Gotcha. Okay, great. And then what would you say are the best parts of your job and the biggest challenge?
The best part of my job is being able to help someone uh, that is obviously in need of care, having a significant impact on their overall outcome. That's the most rewarding to me. I think everybody does the job for a different reason, but I think we all share that one sentiment as far as being the most rewarding part of the job and the best part about it. Um, People don't call us because they're happy to see us. They call us when they need help. So we never really see people in their best form or at their best time. So being able to provide a sense of assistance, physical assistance, being able to provide them with clinical medicine is what's most rewarding. Um, as far as what's least enjoyable, obviously, unfortunately, we see a lot of tragedy. And throughout your career, whether positive or negative, those type of situations stay with you. So, and those are the least, but we try to obviously find the best in all situations.
Yeah, of course. And then would you say that your job assignment changes often? Or obviously with medicine, things are always updating, always changing. So how do you stay on top of, those different skills or knowledge that is required throughout your career?
So every 3 years, when our certification lapses, we recertify obviously before that expiration. So at that time, new information is shared with us, new skills, new techniques are shared with us. Additionally, New York State puts out directives from time to time. Most often during COVID, as we know, things were on a very dynamic basis and directives were changing. So New York State Department of Health was constantly putting out updates, bulletins, executive orders as far as our management and handling of certain situations. So that information will come down from the state, but it's all based through continuing medical education as well. So we will be provided with new and updated information throughout the course of our certifications, and that's how we're updated on the new and upcoming things. Science changes everything, and we have an opportunity to develop along with those strides that they make.
Yeah. I always say medical and technology really are the two career fields that you never really stop learning. You're always kind of learning new things every day. So
Absolutely.
definitely. So obviously, you're in an ambulance, so I would assume that you do a lot of traveling for your job. But is it more, are you assigned a territory? Are you kind of, do you travel far distances? How does that work as far as your job is concerned?
The simple answer as far as travel is concerned, I'm not getting on an airplane and going out of state, unfortunately, I think. But as far as commuting is concerned, I believe most of our colleagues are relegated here to Long Island, Suffolk and Nassau. So as far as commuting is concerned, it's just your local commuting. As far as your transport and your response during the day, you are assigned to a specific precinct, which has post boundaries. So each ambulance has a certain response area that it's primary and responsible for, and then secondary to other locations. But At any given moment, you can be called to respond from the eastern border of Nassau County to the western border of Nassau County. Just depend what the day looks like.
Yeah. And then obviously working in EMS, I think it's kind of obvious that you are more working in teams than you are individually. So obviously, I always talk to teens about, something to consider when they're thinking about what job, career, or field they want to go into is whether they're willing to work well in a team or if they're working individually. So could you talk a little bit about how you work in a team throughout your day?
Sure. First, I'm going to talk about how we work independently. It's a little bit different here in Nassau County. Our ambulances are single provider ambulances. So we drive to the call, the police officers drive, there's 2 police officers at the minimum, respond with us, and they will assist us on our call and take us to the hospital. So as a single provider, that's how we're trained. For a call that is of a more serious or higher priority nature, one of our partner ambulances in the precinct that is available, we will back each other up on those. So even on the single provider calls that we're handling, we work as a team. The police officers, the medics, we all work together as a team. When it comes down to the high priority clinical end of things, working as a team, it's very, very nice to have a skilled set of hands to assist you, especially when something is a little is critical. The majority of our calls are very much manageable by a single provider. But when you have that call that's of a critical nature, it's very nice to have that skilled set of hands. We've had being in a precinct for a while, you have your steady partners. So the communication sometimes you don't even need to talk to each other because you know what the next one's going to do, and it's fluid like that. The teamwork, it's always bouncing ideas off of each other, seeing what you think might work best, what's going to benefit the patient in this particular situation. Like I said, nothing's typical. Everything is different. Every person's different. Every patient's different. So being able to be humble and maintain an open mind is what's very important.
Definitely. And then obviously we've seen an influx of technology, especially within the last year. I know with Zoom and remote learning and telehealth and things like that. So can you talk a little bit about how technology has changed within your career field? And is there anything that you see on the horizon that may be coming as far as technology is concerned?
So I have a list of a few things that's changed. I've been with the police department for 14 years. So I just wrote down a couple of things. I knew I wouldn't be able to remember everything.
Yeah.
But when I joined in 2007, we had 3 lead EKGs, which didn't give us a very comprehensive overview of the heart. So and now we have 12 lead EKGs, which give us a much more comprehensive view. From our ability to intubate, it would be a direct visualization intubation. Now there are video scopes that are available for us, so we have a much clearer picture and look at the anatomy. We have intraosseous easy driver drills, which help us get IV access now. And one of the things that I think has really helped us the most, especially it's helped the police officers because they seem to be the ones doing this part of the labor, is manual CPR. We now have automated CPR machines that do the chest compressions for any of us. So it frees up a person, frees up personnel, and it's very effective. It's continuous. There's no pause. And the return on that is really fantastic. Additionally, also the stretchers. We used to have stretchers that required 2 people to operate as far as loading and unloading patients. And now we have a stretcher that's hydraulic, the legs lift on its own. That's a little heavier than the prior, so sometimes it requires 2 people. But now it's a single operator, and it's much more tolerant of people that are a little bit larger, and it certainly takes the strain off of us physically.
That's great. And then would you say that there are certain times of the year that tend to be busier than others? Is it pretty much a steady workflow throughout the year?
Predominantly, the volume seems to be a little bit higher during the summertime, during the warm weather months. People are out, they're partaking in higher risk activities, especially now post-COVID. Everybody wants to be outdoors. And the warmer weather seems to sometimes breed aggression. People are not as tolerant as in the colder weather months. But for the most part, it's just the increased outdoor, higher risk activity. And I would say that that is probably statistically accurate.
Gotcha. And then I know we talked about the certification that you needed. How does that work if you wanted to move to a different state or a different region, even a different country? How does that licensing work? Are there, more other requirements that they'll need to be taking, obviously, if they're moving to a different area?
So of the certification that New York State provides, the AEMT certification and the paramedic certification, you're able to obtain national registry. National registry allows you to be recognized from state to state as having the certification and being allowed to practice in that state. It is obviously a reciprocity process and so forth and a certification process, but that's how it works federally.
Right, more on a paperwork issue than additional training and things like that.
Yes, and all the training is uniform from coast to coast with the National Registry Program.
Awesome. And then what about opportunities for advancement? Obviously, we know that there's many different branches within EMS. So, are there opportunities for advancement within your organization?
There is. From the professional end of things, the critical care certification, the critical care providers are able to professionally advance to the paramedic level. When it comes down to promotional rank setting, the police medic can be promoted to police medic supervisor and then to police medic coordinator, and then be eligible. Obviously, this is all a testing process throughout to become the assistant bureau director and then the bureau director. Additionally, there are some lateral spots that our members can obtain as well. We have tactical medics that are part of Bureau of Special Operations and work side by side with them and the Emergency Services Unit. We have a fully staffed academy of instructors who train and maintain the educational component for new and current members. Our members are also part of the Nassau County Police Department's peer support team and many other various committees and teams. And lastly, something new to us is a community paramedicine program. And that's been put into motion now during COVID as we've been going to homebound patients and vaccinating them in their homes.
Oh, nice. So that actually leads nicely into my next question, which, was about transferable skills. Obviously, medicine, there's many different fields within medicine and even within emergency medicine. So would you say that you've seen other medics or EMT workers going into different fields? Are there any that you see tend to be more of a trend? Or how does that work? Have you seen any skills being transferred to other careers or other opportunities?
I don't want to say a lot of, but I'll start with saying that I've seen people from our profession advance themselves into nursing, advance themselves into becoming physician assistants, and moving on to becoming physicians. So as far as promoting themselves, we have a couple of colleagues that indeed have. We have a couple of colleagues that work with us as paramedics and our nurses on the side as well. So there is that opportunity. I think once you're in the healthcare field like that and you have a strong foundation, you just have more of a desire to blossom and learn and move on and advance yourself.
Yeah, definitely. And then moving on to some advice for students that may be considering this field of work. Are there any interests, abilities, or skills that you think would help a person to be successful in this particular type of occupation?
I think you need to maintain a level of compassion, a desire to help, have an interest in medicine, and a collateral part of it is the adrenaline rush. A lot of people enjoy that and they get a thrill from it. But sometimes you need to pump the brakes on that and realize what the end game is. As far as abilities are concerned, I feel that you need to be a very good communicator and you need to be a good listener, because sometimes people call you and there really isn't much wrong. They just want to talk. So being able to be a good listener is important. You got to maintain a humble attitude, and be willing to listen and learn, and try to learn something new each day. As we talked about before, this environment is ever changing, so to be able to be humble and open-minded and progress yourself is important.
Yeah, definitely.
As far as the skills, being detail-oriented, good hand-eye coordination, perseverance, determination, and being a good advocate for your patient. If you're able to put all those things together, this field's for you.
That's great. And then also, we always hear from teens, when am I ever going to use this math class ever again in my life? So I always ask, how often do you use math or reading or science, the education that you learned in high school within your current career field? Is there certain subjects that you tend to use more of or less than? How would you say about that?
So we're not doing complex calculus, okay? But we are doing your basic math skills. We're constantly computing medications. We're calculating weights from pounds to kilograms and metrics. Medication dosages, like I had mentioned. That's where the math comes in, and it's not super complex math. But when you have the stress of somebody's well-being and their health, on top of doing the math, sometimes it becomes intimidating. But again, like I said, just pump the brakes a little bit, do your math, keep your head on, and that's it. Is the reading, the writing, the report writing every day. As far as reading reports from other physicians, from medical offices, from reading advanced directives, people's wishes in their final days. It's very important to make sure that you have an understanding of what they're asking for, because these are their wishes. Foreign language skills, it is very helpful in the field, because not everybody that you come across speaks the language that you speak. So being able to be bilingual, multilingual, it is helpful. It's frustrating sometimes when you can't communicate the way that you want to, because this person needs help. But it's a great skill. It's a great tool to have in your arsenal.
Great. And then, obviously we talked about, in order to enroll in the program, you would need to have a high school education. So is there anything that you could suggest that teens could be doing now, either whether internships or part-time jobs or volunteer programs that they could be doing if this is something that they are interested in their future career choices?
Sure. A lot of people sometimes start off by being volunteers in hospitals. So they kind of get a visualization of what goes on from the emergency end of things, especially if you're in the emergency room, and just healthcare as a whole. You can start there, kind of dip your toe in the shallow end of the pool a little bit and see if maybe this is something that you'd be interested in. You can volunteer with a local ambulance corps or a local fire department, and you can assist them with their EMS operation. That'll kind of help you see and get a taste again, and step into the shallow end of the pool and see if this is something that you would like to move forward with as a career.
Great. And then if considering college, are there any particular degrees or majors that tend to be more popular for those involved in your career field? Or if not college bound, are there other sources of, obviously we talked about the training program, but are there any other occupational trainings within this career field?
Going through college, if you have a solid foundation of your biology, your chemistry, your sciences, a lot of people go the pre-med route also. So they integrate all of their knowledge and use it to their benefit, obviously, in advancing through whichever direction of their career that they wish to. But being able to focus on those and getting a strong foundation will certainly help you moving forward.
Definitely. And then I guess my very last question is just any words of advice or any words of wisdom for teens that may be considering this field.
If you enjoy being able to incorporate medicine with compassion and a little bit of an adrenaline rush, this line of work may satisfy your interests.
I just want to say thank you so much for all of your time today and taking time out of your schedule. And just thank you in general for everything that you and your whole department has done, especially during this last year. We cannot thank you guys enough for all that you do for our community. And so thank you so much for your time today. And we really appreciate you joining us.
Thank you very much for the time and the opportunity. I appreciate it.